Hi, my name is Chris Humphrey here at the new GMHC Outreach Coordinator, and I'm here with Omi and Rob to talk about PEP and PrEP. Sorry about that, Omi.
Quite all right. So hello, I'm Omi. I work at the Geffen Testing Center at GMHC.
And I'm Rob. I work at the GMHC David Geffen Center as well.
So like I said, we're here in the new space. How do you guys like the new space at GMHC, our youth room?
I love it, actually. It's very homey. It's a little more intimate than the other space that we had at the old building, but it's very cozy, and you still have the pictures of the young people up. So
It's got the same kind of personality. I like it.
Yeah, the youth seem to like it.
And plus, you've got this big. You guys can't see it, but there's a big window behind.
The view's
us.
amazing.
And so yeah, it's definitely homey. It feels like a safe space.
Yeah, that's what I kind of look that we try to give the youth to get them to come here at the new GMC. Oh, the address is 307 West 38th Street. The Geffen Center is still at the same place. Do you guys have that address?
Yeah, 224 West 29th Street between 7th and 8th Avenues.
Okay. So like I said, yeah, we're here to talk about PEP and PrEP. And this month past was Pride, right? And I know you guys did a lot of testing for that. Did you get, well, you could talk about that a little bit, I guess.
Sure.
Yeah, sure. So we actually didn't test at Pride events this year, but we were able to get out there and invite people to come to the Geffen Testing Center. So to be clear, at the Geffen Testing Center, we do offer HIV testing. We also offer some STI testing, including chlamydia, gonorrhea, and syphilis testing, as well as hepatitis C. Did I miss anything?
No, except for perhaps just that the HIV and the Hep C are 20-minute finger prick tests. So you will have results at the end of those 20 minutes, and then the chlamydia, gonorrhea, and syphilis testing we collect samples for, and those results come back in about 7 to 10 business days.
And all of those tests are completely free to you.
Free and confidential testing.
So yeah, feel free to drop by and visit us.
Most definitely come through. So we also offer linkage to PrEP and PEP services.
Okay, so getting into PEP and PrEP, I guess for those what does PrEP or PEP stand for, I guess?
Okay, that's a good place to start, right? Omi, you want to take it away?
Yeah, sure. I'll start with PrEP. So PrEP stands for pre-exposure prophylaxis. Prophylaxis is just a big word for prevention. So it's a method for preventing HIV before you are exposed to it. So PrEP is one drug called Truvada. So that medication actually is a combination drug of two different kinds of medication. It's one pill that you can take daily in order to prevent HIV, and when used daily, it provides really, really strong protection against HIV. So we can compare that to PEP, which is post-exposure prophylaxis. You want to talk about that one?
Sure. So post-exposure prophylaxis is something that is often referred to as the morning after pill for HIV. And so, which I think is a great term because it is a resource that we have available after a potential exposure. So say, someone had one too many the night before and wakes up and is not sure whether they used a condom or not during a sexual encounter, or God forbid, post a sexual assault situation, or just, a slip up like that many people have, a condom breaks or a condom slips off. If they have concerns about a potential exposure, they can get to a medical provider within a 72-hour window period. So you want to have, and by that I mean that you want to have the medication within you within 72 hours for it to be effective. Clearly, the closer you are to an infection or to the potential exposure, the more apt the medication is to work. And there are many ways to access PEP, either by way of an emergency room, or there is a PEP hotline through Mount Sinai, which is, do we have that number handy? I thought we had that number handy.
The PEP hotline?
Yeah, the PEP
hotline.
It's
844-3-PEP-NYC. 3-PEP-NYC. That's the PEP hotline number that you can call 24/7.
Which is a tremendous resource because so you will actually speak to a provider on the phone as opposed to having to go to an emergency room. You speak to a provider. If they don't pick up right away, please leave a message. They will get back to you within a 20 to 40 minute period. you will get to speak to a provider on the phone who will assess your situation. And then if it is deemed that you are, that the post-exposure prophylaxis, the PEP, is appropriate for you, they will actually call in a prescription to a pharmacy near you, which makes it convenient.
Now, Rob, I have a question. I know a little while back you said that you kind of tagged PEP as being the morning after pill. I know a lot of people, like a lot of my friends in the community, also follow that that connection. But I think a lot of misconceptions that they have is that because it's a morning after pill or like a emergency pill, they can take it over and over and over and over. Is there any, you know, I guess, downside to, you know, exposing yourself over and over and then taking PEP, or are you even allowed to take PEP so many times, like every week, like say if you needed it every week?
That is a great question. You know, I think for people that have a tendency to access PEP over and over again, you know, you have to look at the bigger picture and you have to look at the patterns and, you know, the behaviors of the individual without a judgment, because we really need to meet people where they're at.
Without judging.
Right. And so this perhaps is, you know, the type of individual that you're describing right now is probably a great candidate for PrEP.
Right.
Right. And so, that's the conversation.
So do you think it's kind of like fair to say that if you are that type of person who finds yourself always searching for PEP, it might be a better look to just be on PrEP?
Well, yeah, I mean, to me, it would make
more sense.
You know?
Knowing your behaviors and knowing yourself.
And PrEP, when the medication is already in your system, it's going to work better that way. You know, it's more effective at preventing HIV if it's already in your system as opposed to the medication, you know, entering your system afterwards.
Right.
So yeah, if anybody is accessing PEP, post-exposure prophylaxis multiple times, that person is probably a great candidate for PrEP.
But I think it's also more of a conversation about being proactive, you know, versus reactive. Right. Right. And so, you know, you can come at it from a place of being empowered, or, you know, from a place of, you know, reacting to a situation, you know. And so I think it's empowering to say, okay, you know, I've had to access PEP 2 or 3 times already. Let me be proactive, let me be empowered and take control of my sexual health, you know, and let me protect myself in this way, you know.
Using a prevention or harm reduction method.
Absolutely.
Do you think that with the access of PrEP or people being on PEP, do you think it has changed the idea of what it means to be like healthy or what it means to be sexually safe? Because I know a lot of like the people in the community, they feel as though being on PEP, they no longer have to like wear condoms or think about the other, you know, STDs or STIs that come along with it. Do you think that
We're talking about PrEP now, right?
Yeah.
Okay. Omi?
Yeah, so I mean, in terms of the way that people perceive the risk, I think that PrEP is really, really helpful in helping people get out of their heads when they're having sex. If they have a lot of anxiety about HIV, it can help them really be present and actually enjoy sex. Like, people have sex for pleasure, and if you know, you're constantly worried about HIV, PrEP really, really helps people relax and be able to connect with their partners in some ways. As far as STIs go, so PrEP is of course only effective for HIV prevention. It does not prevent any kind of STIs like syphilis, chlamydia, gonorrhea. Now, if somebody is taking PrEP, they are seeing a medical provider, you know, at least 4 times a year, every 3 months, in order to get STI testing. So in that way, you know, you will be regularly tested for STIs, and the medical provider can find it, can treat it, and can take care of it. And I mean, honestly, we know that people don't use condoms all the time. That's a fact. Like, if people use condoms all the time, like we wouldn't have
a job. Exactly.
Like, this would be done and taken care of. So, you know, I mean, for some people, it might change the way that they use condoms, but for others, it's just like, it just makes sense in the sex life that they already have.
Right.
Correct. And so, you know, I'm really glad that you brought it up in the sense, because part of what I'm hearing is stigma, right? The association that PrEP is for people that are promiscuous, that it gives them permission not to use condoms. But you know what? Consenting adults can give themselves permission to make choices about what works for them,
right,
in conjunction with making a joint decision, right, with the person that they're engaging with the person or people that they're engaging with. And so you know, this is, you know, we PrEP to me is in my opinion is more than just a medication that you take daily, right? You know, PrEP is not only preventative, but it's empowering. It is, you know, it gives you peace of mind. Like you said, it gives you the ability to enjoy the sex, you know?
And for some people, it opens up, honestly, like the number of people that they can have sex with. For some people, it's the first time in their lives they're really considering having sex with somebody who's HIV positive, or like people living with HIV. So it's kind of a frank way to say it, but like it opens up the possibilities for some people.
Yeah. It absolutely. And I think, you know, the conversation about not being able to, or excluding someone who is HIV positive from, you know, potential life relationship, you know, the possibilities are endless now, you know, with this tool that we have. You know, so.
Yep. Well, I know as a gay man of color, I know that predominantly the majority of the ads that I see are directed towards me and like my people and people of color, MSM of color. What would you say to those who maybe think that PrEP is not for them, or PrEP is not geared towards them, who think that, you know, PrEP is only for gay men or Black or Latino men? What would you say to people like that who think, you know, PrEP is not for me, so I'm never even going to use it?
Well, I would say that although I hate this catchphrase terms that I really hate, and high risk is one of them, right? Because how do you really define high risk?
What's high risk to you might not, you know.
Right.
Everybody is evaluating their own risk in their own way.
Right.
Exactly. You know, anyone, it only takes one time, right?
Exactly.
So, but I will say that, you know, there are other high risk populations, right? Women of color, women in general, trans women, but PrEP is something that is available to everyone. You know,
no matter how much you make, no matter where you work, everybody can get it. Everybody can get it.
Absolutely. There are ways to get it, and so it will work for anyone who decides to take it, and who decides that it is something that's available to everyone, right? Not everybody necessarily feels that it is for them.
Right.
You know?
And so when this, you know, came out as a possibility, as public health professionals, I think a lot of, or maybe public health in general, we're trying to reach populations that we generally see as the most high risk, which makes sense, but in doing so, we ended up excluding a whole lot of other populations.
That needed it.
And yeah, that's the fact that it does work for everybody, regardless of sexuality, regardless of your gender.
Right.
It does work for everybody.
It's effective. It's absolutely effective.
Well, for those of you who are just joining us, my name is Chris from GMHC. I'm here with Omi and Rob, and we're here talking about PEP and PrEP. We were just talking about, you know, the changes that PrEP has on how people view risk and things like that. Next, we can get into talking about kind of some of the side effects. I know some people are kind of scared to take PrEP or take any medication because they hear about all these bad side effects. They're scared that if I stop taking it, it won't work anymore. What's some of the things you could tell about like the side effects of PrEP, and does it really have like these big bad effects that people are so scared of that's stopping them from taking it?
Yeah, no, that's certainly when people come into the testing center, that's one of their biggest concerns is what are the side effects. And so for most people, the side effects are actually pretty mild and also temporary. So the most common side effects people will experience upon starting PrEP medication is like it'll affect like your stomach, so maybe like nausea, headache, stomach cramps, that kind of thing is the most common. And those side effects usually go away within a couple of weeks to a month max is the usual.
Well, go ahead.
Yeah, so yeah, they're usually mild. Oftentimes you can kind of manage them with like over-the-counter medication if it's really bothering you. But yeah, most of the time it's temporary.
And how long would you have to, like, if I started PrEP today, how long would I have to be taking PrEP for it to, like, I guess, start having an effect in my system? Is that how PrEP works? Like, do you have to take it for a certain amount of time before it starts having an effect?
So,
So absolutely, it takes some time to build up in your bloodstream in order for it to work properly.
To be effective, yes.
Right. So for anybody who's having receptive anal sex bottoming, it takes 7 days of taking PrEP every day for it to reach that maximum level of effectiveness in rectal tissue. And then it takes 20 days of taking it, so about 3 weeks for it to reach that level throughout your body and in your bloodstream.
And that's 3 weeks where you shouldn't be missing any doses, you shouldn't be skipping any,
Well,
you know?
You shouldn't
be missing doses, period, but...
Now, this is also a misconception, right? Because sometimes I've heard from people that, you know, in the conversations about PrEP, that it's PrEP, because it is a medication that you have to take every day, that's one of people's concerns. Like, I really don't want to take a medication every day. Right. And so the questions then become like, well, can I take it when I'm more sexually active versus, you know, when I'm less sexually active, can I come off the medication?
Right.
And the thing is that you're kind of you're playing with it at that point, and you whether you're more sexually active or less sexually active at any given time, the levels of the medication need to be at a certain level in order for it to be effective. So, you know, it's not like you can pop them because you're going to have an active weekend and then come off on one day because, you know, you're going to be less active during the week. It doesn't work that way. You need to adhere daily. Now, if you do miss a dose here or there, you know, it's just important to get right back on, you know, as soon as you can.
And I think that's important to say, how like a lot of people who are on PrEP, I know from experience and having friends, a lot of times people make up their own rules. They make up their own rules on how they want to take medication, which leads to the PEP or the PrEP not even working. So then you're starting to fuel more like misconceptions and myths that PrEP doesn't really work and all this other stuff. And 9 times out of 10, it's because of, you know, people using it incorrectly or not having the right kind of information to take it properly. Especially like the young people, you know, who are so peer pressured into believing, I guess, the masses, and which is why things like this is so important, just to get the right information out there and eliminate those myths, eliminate those misconceptions, so that everybody's, you know, taking PrEP the right way and it's working ultimately the right way. What's one thing you could kind of say to like the youth who are trying to get on PEP and PrEP, who don't really have access to, let's say, their insurance information or their health information, or they don't have parents to like back them up, you know, to help them get this PrEP, but they feel like they need it? What could you say to like youth who are trying to get access to PEP or PrEP? You know, the 18-year-olds, the younger than that, you know, the people who might need it more than, you know.
Got it.
Yeah, so definitely one of the challenges with getting on PrEP is that it's so tied to being able to get to a doctor. So for young people, that might mean that they don't have insurance, or they're on their parents' insurance, or they don't want their parents to know. That's a big thing that comes up a lot, and you still can't get on PrEP. There are ways that, you know, there are programs, especially in New York State, that exist that can help you.
We are very fortunate to have the resources that we do in New York, and PrEP and PEP are very accessible. So, you know, the idea that you can't get it because, oh, I don't have insurance, or oh, my insurance doesn't cover it, or oh, I have really high deductibles, or whatever the case may be, there are ways for you to access it, even more so in this type of situation that we're describing, where you can access it at low or no cost. So.
Yeah, so New York State has a program that covers people up to a certain income level that will cover the doctor's visits, the lab work. Gilead, the pharmaceutical company that makes the medication, has an assistance program for people, up to a certain income level. And those programs will work for you know, young people who are on their parents' insurance and have concerns about privacy. That's an option that's available to them. And
these young people, they can use the PEP hotline number and call that too, could they, if anything?
Yeah, if they need access to PEP, then absolutely those people should reach out, because there are ways to get the medication.
And that number again is 844-3-PEP-NYC for anybody who needs to call. They're open 24/7.
Yeah, no, go ahead. I was going to say, if anybody needs or would like to speak to somebody about getting on PrEP and about like the specific options that are available to them in terms of working with insurance, you can come visit us at the Geffen Testing Center. We have people who are available and specialize and can talk to you about that.
Absolutely.
Absolutely.
We have an entire team that is waiting to receive you. And so I did want to go back to the question about side effects and about people who express concerns about taking a medication every day. And you know, when you think about side effects, right? There's a side effect, a potential side effect to not taking PrEP. And the potential side effect to not taking PrEP is being infected by HIV, right?
That's
and
true.
so Truvada, as Omi mentioned before, is a medication that is actually used in conjunction with other medications to help treat HIV.
Right, I was gonna say Truvada is part of, some people call it a cocktail, it's part of the cocktail that they take. Could they take that same Truvada pill though? Sorry to cut you off, but could they take that same, like, if I was on HIV meds and I took Truvada, could I give somebody my Truvada pill?
Well, so I think, one, I think the doses are different. So first off, let me say that we're not providers, right? We're not doctors.
Right.
So, but my understanding is that the doses are different, and also when more often than not, the newer cocktails that have come out to treat HIV usually have the Truvada in one pill.
Yeah.
Is, you know, there's a bunch of medications
In one.
pill.
Okay.
So
you're saying no?
Yeah.
Also, like Truvada is Truvada in terms
Right.
of the dose, but like if somebody is using Truvada for their, you're asking if somebody's using Truvada to treat their HIV if they're like going to share dose with somebody. So that means that that person who should be taking Truvada for their own health is now missing pills, which is not great.
Yeah.
And that the person who is receiving that Truvada doesn't have like an extended amount of Truvada to take it every day.
Plus,
So
someone who's on PrEP should really be getting their medication through a doctor.
Right. As all people should be getting their
Right.
medicine through a doctor.
So, but that's a great question because I think people do have that.
Some people have them. Yeah, they have them.
Another thing I think it's really important to point out is that Truvada on its own is enough to prevent HIV. On its own, it's not enough to treat HIV. So
Really
for people
important.
who are taking PrEP, it is really, really important to
Can
get
you repeat
tested
that one more
before
time?
you
Because that was
start.
something new that I didn't know.
Yeah, so Truvada on its own is enough to prevent HIV, but Truvada on its own is not enough to treat HIV.
Oh, wow.
Truvada used with other medications is used to treat HIV. So if somebody is on is starting PrEP, they need to be tested to make sure that they're HIV negative before starting, and then repeat that testing every 3 months to make sure that they're staying negative. Because if somebody becomes positive, Truvada is not going to be enough to treat the HIV.
To anyone who may be hesitating about, you know, maybe having the PrEP conversation and maybe hesitating because of the idea of side effects too, I would say this, that as I said earlier, the side effect to not being on PrEP potentially is becoming infected. And so the thing with PrEP is that at any given time, if for whatever reason you, you know, the side effects are too uncomfortable for you, or if you decide 2-3 months down the line or a year down the line that, you know, PrEP, the whole thing, the PrEP thing is not working for you, that you made the decision to come off, you have the luxury to come off, right, of PrEP. But once you're HIV positive, you know, a lot of the side effects that are associated with PrEP would also be associated with starting a new regimen for HIV. And in that case, you don't have the luxury.
Of
you know, you
getting
will be on a medication
for the rest of your life.
You know, unless they come up with something else. But so, you know, that's also something to consider.
I know earlier we was talking about people not wanting to take a pill every day, and I just recalled reading an article about them coming up with other forms of PEP and PrEP. I know they were thinking about like an injectable thing, so that I don't know how often you would have to do it, but do you know any information on that for the people that, you know, are thinking about maybe they don't want to be on PrEP because it's a pill every day, as opposed to the injectable?
Yeah, so there is research being done on some other forms of like ways to get PrEP in your body, basically. And injectables are one of those that are currently in clinical trials. So that would be, I believe, an injection every 2 months.
Okay, and that's way better than taking a pill every day.
Right, for some people, it's definitely a better fit. But yeah, that's still in clinical trials. It's still a ways to go. So I don't think we're going to be seeing that for years.
It's on the horizon.
It's on the horizon.
I mean, people are also looking at like rings that you can like use vaginally and things like that. There are a bunch of things that are possibly on the horizon, but for now, it's the daily pill.
We spoke about it. Did we speak about people without insurance, with insurance? We spoke about that, where they could get it from.
Briefly, yeah. There are resources available.
You want to touch on any resources?
On the subject?
Yeah, sure. Like I said, in New York State, we are lucky to have an assistance program that covers doctor's visits and medication. The Gilead Medication Assistance Program is available nationally in order to cover the medication for people whose insurance, who either don't have insurance or whose insurance does not cover the medication. And even for those who are insured and might have like really, really high copays that they have to pay a lot of money every time they go to the pharmacy, Gilead also has a copay coupon card system that can cover up to $4,800 a year in copay costs. So yeah, there are a few things that exist both nationally and just within New York State that can help defray that cost and help get PrEP to the people who need it.
Nice.
Someone says, my doctor refuses to give me PrEP, says I'm not at risk, but I think I want it, it's right for me, so I'm a little frustrated. What can I do?
Okay, so the question is from somebody whose doctor is refusing
to give them PrEP.
So yeah, this is actually something that I've also heard from people who come into the testing center who have approached a doctor who is frankly misinformed, it would seem, or just like not up to date, and are saying, oh, you're not having sex with men, so therefore you don't need PrEP. We can get you to a doctor who knows what they're talking about with PrEP a little bit better. Yeah, if you have a doctor who doesn't know, isn't comfortable, you can ask that doctor for a referral, or you can contact us to try to find somebody who knows better and will be able to help you out better.
Because if you're trying to get on PrEP, they shouldn't be trying to deter you from getting on it, right?
Right. You as an individual, you know your sex life. If you think PrEP will work for you, then that's something that you should pursue.
Right, exactly.
And there is actually a hotline, I don't have the number on me, but there is actually a hotline for medical providers who would like to learn more about PrEP.
Oh, nice.
So yeah, there are resources for providers who are willing to learn. They can learn. The information
as well as resources for those trying to get it.
And resources for those medical providers. So yeah, I would say that to that person, advocate for yourself, get yourself to a medical provider who will listen to you.
For those of you who are just joining us, my name is Chris. I'm from GMHC. I'm here with Omi and Rob. We're here talking about PEP and PrEP and everything about it. Where were we at, you guys? Do we have any questions?
When it's a comment?
Oh, a comment.
I think I'll wait for the PrEP injection. This pill thing, what advice would you give?
So because, well, weren't we saying there's no real date on when the injectable is coming out. In the meantime, if you're not trying to get on PrEP, I would suggest preventive measures like condoms and getting tested and knowing your status, talking to your partner. There's plenty of things that you can do.
And really just inform yourself. You know, knowledge, not to sound corny or cliche, but knowledge really is power. And, you know, there are a lot of misconceptions about PrEP and PEP out there. There is a lot of stigma. And so, you know, have a conversation with your doctor, with other providers, with testing counselors, people who really know the ins and outs of PrEP, PrEP and PEP. And just, you know, have the information. It's better to have it and not need it than need it and not know it.
Yeah, and like we said, the injectables, they could be years off at this point. So if you think that PrEP is something that could work for you, I'd encourage you to consider the daily pill for now.
Absolutely.
I mean, I understand why people would want different methods. Like a daily pill isn't for everybody. Like we've seen it with birth control. You know, like the pill isn't for everybody, so they came up with other methods. And there are options available, and hopefully we'll get there with PrEP as well. But for now, we just have the pill.
For now, we have the pill.
Yeah.
I have a question. Like there's all the patient assistance programs and within the state, but I know, you know, Rob, like, you know, this thing, who is at risk, who's not, it's a huge thing for the community, but why are numbers low uptake for people who've been so exposed to what's stopping? What do you think are the issues that are really like stopping, other than the others ones you just said about stigma and all? What are the other things that are really like stopping people from using the services?
Well, I think the biggest problem with most things is information. A lot of people don't have the information, or they just have the wrong information. They don't know how to access it. They don't know where to go. I know, like, buildings like GMHC, we move every day, so little information just on addresses, you know, can deter people from getting services they need. So I think just keeping people informed, and it's also up to the community to ask questions and look for the correct information, you know, not to always take information from like word of mouth per se, but to make, like you said, do your own research, learn stuff for yourself, inform yourself. I mean, it's your health, it's your body. I would want the information from the source's mouth, the correct information. So I think just misinformation is a big deterrent from people to do lots of things with their health, not just PEP and PrEP, but even just going to a doctor, you know.
Yeah, and I think that the PrEP being so tied to getting medical care is something that deters a lot of people who maybe have not had great experiences with doctors and nurses in the past, maybe because of their sexuality, race, etc. They, like, people pass judgments and, like, they don't have good experiences, so you don't want to go back to those providers. So I think that's something that also really, really can impact folks. And I think we're pretty lucky here in New York City with the providers and the resources that we have here, and that is certainly not the case all over the country. And in some places it really can be a challenge to find knowledgeable providers and providers who are you know, willing to work with folks. But there are also resources available for that, for being able to find medical providers across the country. I think Project Inform is one of those places that has a provider directory. So nationwide, they'll try to compile folks who know about PrEP, and so you can get some guidance on where and who to reach out to.
Right, the correct people to reach out to.
Absolutely.
So along the lines of PrEP, I know we touched on a little earlier about PrEP and the relationship that it has with, like, STIs and condoms. Do you think with the increase of PrEP using, do you think, well, I don't know the numbers, and maybe for anyone who's looking for the numbers, has there been an increase in, let's say, STI numbers with the uses of PrEP? How has that affected, I guess, STI numbers or whatever that, how has the relationship of those two been affected since PrEP, or, you know?
Yeah, so there have been some preliminary studies that look at a couple different things. So one of those relationships that people are exploring are PrEP use and how it can affect condom use. And so I know right now of 3 different studies that all found different things. Where
there are studies that will support all these, you know, all these different outcomes.
So right now, like, there's like a survey that I know about where people reported lower condom use after starting PrEP. There's a survey that I know about, or actually a study that was an observational study where they saw actually an increase in condom use when people started PrEP. And there's another study where it stayed about the same. So yeah, I guess kind of data is still not really clear on how PrEP is going to impact condom use.
Right.
And so the other thing that people are curious about is the relationship between PrEP and STIs. And so in general, nationwide and in New York City, a lot of STIs have been on the rise. And so when we're looking at STI rates, it's not enough for us to say, oh, STIs are on the rise and people are taking PrEP and therefore the two are related.
Right, it's not, it's unfair to mix the two.
Yep. So when you actually kind of parse it out and try to compare groups of people who are engaging in the same kinds of activities and separating those who are on PrEP and those who are not on PrEP, then actually we're seeing so far about the same rates. And like I said, if you're on PrEP, you're seeing a medical provider regularly, and so you're regularly getting tested and treated. So that's what we know so far.
Right.
Absolutely.
Anything else about PrEP? So yes, here again with Rob and Omi from the Geffen Center here at GMHC, talking about PEP and PrEP. For those who join us who don't know where they can get PrEP from, do you guys have information where they can get PrEP? Any numbers, any address for anyone looking for PrEP or trying to get on it?
Yeah, sure. So you can always come see us at the David Geffen Testing Center. We are located at 224 West 29th Street between 7th and 8th Avenues. and we can help link you to medical providers.
And all this information, sorry to cut you off, Oni, is in the link below. It's in the comment section. So if you missed it while we were talking, you can definitely get it in the info section, along with the PrEP hotline number, which is 844-3-PrEP-NYC. But once again, it's going to be posted down there on the link.
Yeah, so I think we were talking a little bit about people deciding to start PrEP and kind of being unsure about stopping and starting and that kind of thing. And so one thing I do want to say is that, which we also kind of touched on, I guess, but like starting PrEP does not necessarily mean that you have to be on PrEP for the rest of your life. People have changes in their sex lives where sometimes they're with one partner for a while and they're only having sex with that one partner, and then they break up and their sex life starts looking different.
Right.
So, you know, there's this idea of like seasons of PrEP where, you know, if you find that your sex life is looking different and you're having sex with a lot of different people and you think that, you know, PrEP is a good fit, you can take PrEP for a certain period of time, kind of on the order of months rather than days.
Right.
But you can take PrEP for like a number of months and then decide that, you know, your sex life is going to look different, and yeah, you can stop. And there are no bad effects.
And I was just about to ask that, will that have like adherence issues if, you know, for people who say, I'll just take it this month, stop taking it next month, take it this month, you know, take it, you know, that won't affect any issues, that won't have any issues like with adherence or the medication working? So
you just need to make sure when you stop that you're using other methods to protect yourself, because the PrEP is no longer going to work. And when you're restarting, you need to be cognizant of the fact that it's going to take time for the medication to build back up in your bloodstream. So again, that's 7 days specifically for rectal tissue, and 20 days, so about 3 weeks, for it to build up in the rest of your body. So like a month off and a month on is not. It's not good because you would be building it up every month just to. By the time you built it up, it's pointless. But on the order of like maybe say 6 months, like that could make sense for people. Yeah. You could stay on PrEP like if I wanted to be on PrEP for the rest of my life, you could be. You could do that? You could if you decide that that's your method of protection. That's what you're comfortable with.
Well, that's good to know. For those who didn't know it.
So do you prescribe it at Geffen?
That is a very good question. Unfortunately, at the Geffen Testing Center, we do not have any medical providers who can prescribe PrEP to you. What we can do is let you know all about it, work through insurance issues with you, and find a medical provider who will work for you.
We have many partnering providers that we work with, so I'm sure, you know, as long as you're within the 5 boroughs, that we have somebody that's probably close and convenient to you.
Nice.
Do you have one location only, Geffen?
Correct. We only test at one location, which is the Geffen Testing Center, although you might find us out and about testing off-site sometimes.
Okay, nice.
But again, for those of you who may have missed it, we're located at 224 West 29th Street between 7th and 8th Avenue. And we have walk-in hours most days, Monday, Tuesday, Wednesday, Friday, from 9:30 to 5:30. On Wednesdays, we close for administrative duties from 12:30 to 2:30, but we reopen for walk-ins at 2:30. Thursdays are by appointment only, and Saturday we have walk-in hours from 9:30 to 1:30. 9:30 a.m. to 1:30 p.m.
And you can find that all spelled out on the website.
Absolutely.
And what's the website?
gmhc.org, and then you would just click under the testing services, and all of that would be mapped out.
And we could put a link to that right in the comment section too. I want to thank you, Rob and Omi, for sitting down talking to us about PEP and PrEP. I know I learned a lot. I hope you guys take away some nice little information from this. You guys have any last words before we?
Come visit us if you can.
And come visit us at GMHC.